One of the most important vitamins that probably most of us, whatever background, what ethnicity you're from, is vitamin D, and most of us are deficient in it. Hello and welcome to another weekly newsletter here at Vysana. I'm Dr. Sunny Dhesi, GP and aesthetic doctor. So what have we got in store for you this week? So mindfulness, menopause and medicine, and of course, most importantly, skin. If you are watching this on the weekly email, the video newsletter, please, would you mind going across to YouTube, searching for Vysana Life and hitting the like button if you do like it. So please do hit the like button and hit subscribe as well. And then there's a little bell in the top, left-hand corner of the screen, which is for notifications. So it might be at the bottom actually, but wherever the bell is, ding that as well. So whenever we do post on YouTube, you'll get a notification on your YouTube channel. So please, if you are watching this on the email, just switch across on your phone maybe, or on an iPad to YouTube, search for Vysana Life and give us a like, a subscribe and hit the notification bell. And I would greatly appreciate it. So let's carry on with the newsletter. So my first thing to talk about was mindfulness. Now, mindfulness, mindset, there is so much wealth of information out there about how to improve our mindset. We can listen to affirmations in the morning. We can practice affirmations. If you don't know what affirmations are, these are things where you create or you say positive statements and they ingrain into your psyche to help you kind of dispel negative thoughts. The basis of that is probably something along the lines of CBT or cognitive behavioral therapy, where if you have a recurring negative thought, you try and replace it with a more positive one, or it's the base of NLP as well. However, I just want to share something very simple with you. So obviously you might have noticed the weather has changed. It's a little bit darker. One of the most important vitamins that probably most of us, whatever background, what ethnicity you're from, is vitamin D, and most of us are deficient in it. Most likely because a lot of our foodstuffs don't contain enough vitamin D. For example, mushrooms are a good source of vitamin D, but the likelihood of you having mushrooms every day to improve or supplement the vitamin D levels that you should have, it's highly unlikely. Now, some of you may be watching this and thinking, well, I'm out in the sun, I get enough vitamin D that way. Well, the problem with our temperate climate is there's a lot of cloud cover. We don't fully expose ourselves to the sun. I'm not suggesting that here in Rutland that we start up anything untoward. However, it's usually just your face, your neck. If there was a high midday sun, or the sun was out and you exposed your arms fully and went out in the sun, and you spent about 20 to 30 minutes to give you a boost of vitamin D. But for those of us who are, for example, darker skinned or from a different ethnic background, then there will be a deficiency. So for mindset, for potentially low mood, why not supplement with a vitamin D supplement? Now, we do have one that we recommend through Get Harley. So if you would like some more information on that, just email us at information@vysana.com. And if you already have a Get Harley plan, then we can add that vitamin D, that sunshine in a bottle for you. If you're looking at other sources, obviously the usual places you can go, places like Holland and Barrett or Sainsbury's, but the one that we recommend, we know is not clinically, it's not a prescription medicine, but it definitely is efficacious and it has a high dose and it definitely absorbs well. So I would definitely recommend vitamin D for mindset. There's a running theme then today. If we talk about mindset, I was recently reading about some menopause related information. Now, our focus obviously in clinic, as you can tell with the skincare brands behind us like Lumiere and of course Made of More, is that it's skin. However, my approach is to start from the skin and work our way within. And one of the discussions that we often have in clinic with patients is about dementia and Alzheimer's. Now, for many of you, it's possibly a distant thing in the future that you may sometimes be worried about. However, for some of you, you might have older relatives that are suffering with dementia, Alzheimer's, or they are being investigated for it. You're starting to notice changes. And I think this is one of the aspects of women's health that's just so confusing. We are increasingly more aware of dementia and diagnoses like Alzheimer's. So I wanted to share some recent research. It's called a meta-analysis. So that's where a team take lots and lots of different published papers, and then they analyze the results of those papers to see if there is any trends. And now this was done by a Dr. Mosconi, and they did a meta-analysis of HRT and Alzheimer's and dementia because there's some recent news and controversy around it. And what they found was that when initiated in midlife or within 10 years of menopause, estrogen-only therapy is associated with a 32% reduced Alzheimer's risk. And estrogen and progesterone therapy, so that's where you have estrogen and progesterone, is associated with a 23% reduced Alzheimer's risk, though there are more variables in that effect. Now, basically what that means is that if you are starting HRT within 10 years of the menopause, or for in midlife, which is in your sort of 40s and so on, or whichever way you want to view it, but definitely mid-40s. The point is that it does reduce the risk of Alzheimer's dementia. This is from a published meta-analysis. Now, the question is raised, what about if you are after age 65? And now, the sad thing is there's not a lot of research out there for the age after 65. And what they found from the meta-analysis, that estrogen-only HRT doesn't reduce the risk, and estrogen and progesterone therapy may unfortunately actually elevate the risk. Now, that doesn't mean they're causative, it means what they found. So I just wanted to share that with you because obviously it's something that I've discussed with patients. Their relatives have got Alzheimer's, mum and dad might have been developing Alzheimer's. And the question is there a genetic risk? Is this something I'm prone to? And I think there are so many environmental factors, so many outside factors, that if we can do the things that help us internally, physiologically with hormones, then why not do that? So, long and short of it, very interesting meta-analysis study, and the message is that due consideration, if you are worried about Alzheimer's, dementia, brain function, well, it is important to consider HRT within 10 years of the menopause or even in midlife. So I hope you found that interesting. Again, if you have any questions or you want to book in for a private consultation, you can, please do. Finally, onto skin, which is always a passionate subject for me, and especially about skincare. So I probably have mentioned it already, to whether in clinic or if on this video, that we are firmly and passionately standing behind a brand that I helped to develop called Made of More. And one of the things that Made of More is great for is the HC complex. This is the special actives within the products that help to reduce inflammation in the skin. They help to improve the microbiome by supporting natural bacteria that should be on the skin. And also they have an antimicrobial effect. And they also help with improving the transepidermal, or the skin mantle as it should be. So that means that, you should have a natural skin mantle that helps prevent water loss. When you have water loss, you get skin dryness and skin tightness and itching. So I've shaved especially for this video. I have been growing a beard. It has been half term, but I thought, why not demonstrate? So here we have quite a significant amount. Now, active clinical products aren't for everyone. I always recommend trialing them. We always test them out on your skin in clinic to make sure that they work for you. You like the feel, the consistency, the richness of the product. And in a lot of cases, what we found is that the Night Souffle, great name, Night Souffle, here we are, from Made of More, not only doubles up as a great nighttime night cream, double entry there, nighttime night cream, it also is great as a neck cream as well, for those very reasons. Especially with this change in weather, what we're experiencing is more skin dryness and tightness, especially the central heating coming on. So I said I would demonstrate it, so here we go. Now normally for the neck, I think both hands are fine to apply. And you want to, it goes on quite well and it takes just a few seconds to absorb in. I would use both hands when applying it, and you want to use long motions on the skin. And the skin here can be a little bit thinner. You might have noticed some crepiness creeping in. You might have noticed that the skin is sagging. It's not as resilient. It's not as elastic as the rest of the face. And that's why using a neck cream or a night cream to rehydrate, to help support the natural barrier function of skin, gives the skin a little bit of a glow. And as you can see, that's absorbed in really quickly. I think even with a beard, it would have done. So I helped develop Made of More with Jackie Lamian, the founder, over 2 years. It's a British-made product. It's the HC complex is actually derived from actives that are farmed in Lincolnshire. So that's my little pitch to you. It is a great product. There are other products as well. It doesn't always suit everyone's skin, but what I will say is it's very much focused on perimenopausal and definitely menopausal skin. And with this change in weather, I think your skin just needs that little bit of TLC, which obviously we provide here at Vysana. So thank you very much for watching. If you've enjoyed it, please, as I said at the beginning, head over to YouTube, type in Vysana Life, all one word, hit the like button, the subscribe button, and also the notification bell as well. And I will see you next time for our weekly newsletter. I'm Dr. Dhesi, and this is Vysana Life.